Welcome to Tumbe Medical and Dental Specialty Center, Ask Our Expert program. We have received so many questions from our different social media platforms. To answer all your queries, today we have with us our senior specialist pediatrician, Dr. C.S. Kumari, who has a vast experience of 38 years and currently working with Tumbe Medical and Dental for the past 8 years. Hello, doctor. Welcome. Welcome to Ask Our Expert program.
Thank you.
Doctor, my very first question. We are not hearing much about COVID positive cases among children. What do you have to tell us about it?
There is a lot of confusion among COVID-19 in children because it is less prevalent and less serious. Case fatality rate is very less when compared to adults. Studies are not many in the literature. Among one study in USA, total population of children in USA is 22%, and among COVID patients, 2% of patients belong to pediatrics. And COVID is transmitted to children by household contacts, community spread in 90% of cases. In 10% of cases, they get from traveling. One study in China, they have done study in pediatric population, 2,140 children they have taken. 5% of cases are asymptomatic, 51% cases are mild, and 39% cases are moderate. Only 5% of cases are severe. Among them, 1% are critically ill. Multi-system inflammatory syndrome is seen especially among pediatric population, and it is very severe. It causes multi-organ failure.
One very common question, doctor. Parents are asking when can they send their kids back to school?
It is a very difficult question to answer. Children are not immune to COVID-19. They do get the disease. That is the reason why when WHO declared COVID-19 as a pandemic on March 11th, 2020, schools were shut down immediately. And for the other reasons like economic reasons, and child is not comfortable with online studies, and child is not understanding, and many psychological factors are there in children because they are not going to the school regularly. Schools are open now, but my personal advice is not to send to school unless the children are aware of the COVID-19, how to take precautions and wearing mask. We have to teach them how to wear mask and how to remove the mask, and they should not touch the in front of the mask, and they should not touch with the hands of their faces, and children should know how to sanitize their hands. Sanitizers are not allowed in children, and hand wash with soap and water is advisable, and it is better than sanitizers. School should prepare the hygienic conditions, cleaning the premises, and fumigation is very important to remove the germs, and they should see, teachers and administrators should see the child how he is taking care of his personal hygiene. So my personal advice is till the parents are not comfortable and COVID is still continuing, better not to send to school, and online classes are there. We have to encourage the children to take online classes.
Already it's a flu season. Doctor, how important is it to give a flu vaccination for our kids, especially in this COVID times?
Flu vaccination should be given every winter, and already September end and October already winter started, and children should be given flu vaccine every year, and every year the vaccine is changed and new vaccine will come every year. And flu vaccination we can give from 6 months onwards, and first time when we give in 2 doses, and every year we have to give 1 dose. And it is very important because there is a differences and similarities are there in COVID-19 and flu. So it is very, very important to give flu vaccine. Not only that, routine vaccination should be encouraged because many patients and children, they have not taken vaccination during lockdown, and parents are anxious that whether to give late or no. There is no problem. we can go ahead and encourage the parents to bring children for vaccination.
Doctor, how can we differentiate a common flu from COVID symptoms?
There are many similarities when patient comes with the symptoms of COVID and flu, like upper respiratory tract symptoms. But when it comes to the differences, COVID is more contagious, and incubation period, if we take, COVID has 14 days of incubation period with average 5 days, whereas flu is only 2 days. And when come to the infectivity of the virus, COVID is more infectious, and the infection comes from the COVID. It takes nearly 10 days, whereas flu only 4 days. This is the differences. And when it comes to the treatment, COVID has no FDA approval treatment, whereas flu, if it is not coming down with symptomatic treatment and if it is very severe, antiviral medicines are there. And regarding vaccination, COVID-19 vaccine is not yet ready. Still, trials are going on, and there are no studies in children so far. Whereas flu vaccine is there from ages, and we can vaccinate the children to prevent flu.
Doctor, one last general question. How can we assess our child growth and how can we improve their immunity?
It is very important questions in COVID period. Growth assessment is usually done in each visit of the child to the pediatric department. First we'll take vitals, that is height, weight, head circumference, chest circumference, and BMI. When child enters the pediatrician's room, pediatrician concentrates, one vision always will be there on growth. And we have many charts and also formulas to calculate the growth. And growth is very, very important, and the very common cause is nutrition and socio-economical factors. Regarding immunity, child should be given fresh and healthy diet. And second is physical activity. They cannot participate in group games. So cricket and football is not allowed. They can play in an open ground with his siblings, and it should be allowed, it should be encouraged. And whereas regarding the supplements, definitely we have to give supplements during COVID to increase the immunity, especially vitamin D, because children are not going in the sunlight, not going to the school, not playing in the playground. They have deficiency of vitamin D. Along with the multivitamins, we have to give vitamin D.
It was really a very informative session. Thank you so much, Doctor. Thank you so much for
Thank you
being
very
with
much.
us.
Thank you very much.
Thank you, everyone. Stay safe, stay healthy.